Good.
All right, you guys, welcome back. We are in a midweek podcast episode this week. This is the one that I've been hyping up all week and last week. I told you guys that we had a former employee with the OMMA that was going to be joining us live. And so today I'm grateful to have Miss Alicia Schoel here with us. So one, thank you for joining us.
Thanks for having me, Summer.
Absolutely. So just kind of a real quick backstory here is that, whenever I seen you at the Executive Advisory Council meeting the first time, right away, I knew I wanted to reach out to you and to connect because you had been put in the position of patient services with the Oklahoma Medical Marijuana Authority.
Mm-hmm.
And being a patient and patient advocate, I was like, oh, okay, this is someone that I can rely on and talk to and get feedback from. And by the way, you were really great at that. I called you a couple of times actually for stuff.
Yeah.
And I've got to say, if everybody else at the OMMA received questions and responded the way you do, we would have a communicative agency that answers questions. We would get feedback, we would get understanding, we would get so many things. So I'm just gonna throw this in there. Hey, OMMA, take some humility lessons. No, I'm joking. I always have to throw a dig out now and again. So we love them, but we don't. But no, patient services, there was a lot of us in the community that when that position got announced and you were hired in, that we were like, okay, well, it sounds good, but what is it?
Mm-hmm.
So I guess my first question would be like, what was the intention for patient services?
So definitely the intention behind that is I think we've chatted a little bit about it historically, but trying to make sure that cannabis has been legalized on the backs of medical patients. So I look at it as, with my background, especially being a nurse, is that I am a patient advocate kind of first and foremost in pretty much any discipline, whether it be cannabis or cancer or healthcare issues. And so that is really what the goal was, is to be an advocate for patients in addition to providing education on how you manage with medical cannabis. There were a lot of people that I encountered, local universities, other state agencies, that were asking for the same things that patients are. What's the education? What do we need to know? We don't want to hear about seizures anymore and plants being burned and destroyed. That's great. That's been going on. But now what do we do with it? We know it's here. What happens? How do we manage this? How do we educate ourselves? And so that was the goal of that position, was to, in my mind, be a liaison to all of those different areas.
Right. Well, and you relocated here to Oklahoma to come and do this.
Yeah.
Minneapolis, Minnesota.
Yes, exactly. I will say that 85 degrees has been much nicer than the 40 I will be returning to, but
yeah, I don't know if the humidity's great here, but
yeah, that's true story.
Right.
Yeah.
And so when we were kind of, talking prerequisite to this interview, we were talking about some of the questions that patients and people have had in this industry. And one of those was whether or not you had received any form of an incentive to relocate to come and do this position.
No, there was no incentive. It really was just a unicorn of a position with my background in nursing and my educational training in cannabis. And then just, my own passion for medical cannabis, and it was just really a marriage of the two. So it just happened to be kind of just a lucky strike.
Right.
So no incentive. It would have been nice for my own pockets, but only from the standpoint of my moving costs here and back. But other than that, no, it was just offered as a job.
And you had a vision for what you were going to try to achieve when you accepted the position.
Correct.
Before ever making it down here.
Yep.
And we're speaking somewhat in past tense.
Correct.
Because you are no longer with the OMMA.
Yep.
And so I want to make sure that that's clear to people that she's no longer with the agency. But some of the things that we want to ask about patient services is so I called you about patient cards,
correct,
caregiver cards and stuff like that. What other things would a patient have been able to call you about?
I think primarily both patients I started conversations with providers, with physicians. I think the goal that I had is that I wanted to be not necessarily just a resource for the patients, which to me is obviously foremost, but I wanted to be a resource to the community. And that is how I view any state cannabis agency, is that I guess I look at it more as that it's a public health agency. It's not just a regulatory agency. And especially in a medical cannabis market, this is not a small business association. It's here on behalf of patients. I appreciate the fact that it is a business industry. It's highly regulated. It's can be a really dirty industry in some parts. That's 100%. Nobody's saying any claim to that. However, I think though that again, I've said it and will continue to say it until it's not true, is that, cannabis has been legalized for most people on the backs of medical patients. And now whether or not you identify as a recreational user or a medical patient, I mean, that's not for me to decide. However, for those that need it, that's what the agenda has been pushed on. And so my goal was, and always will be, is that patients still always have attention. I take it from a very medical perspective. I could care less if someone uses recreational adult use. That's not my personal business. But if I'm here on behalf of patients that need it, and that's part of their medicine, and that's what they need to get up and go to work and take care of kids and work their next day, then they need a voice. And that there has to be some sort of partnership between the people and the agency, and not even just speaking indirectly to OMMA. I mean, I feel that with any cannabis agency, obviously there's a huge regulatory component, but again, I still stand by the fact that it's not a small business association. I mean, it needs to have a larger medical component. I will say one of the things, and I said that openly, one of the things that I was kind of always surprised by was the fact that I was the only medical person in the agency.
Bingo. And now there's none.
Yeah.
With you gone, there's none. And that's scary. That's scary. We've got attorneys that are heading and leading up this agency that, in my opinion, an attorney's best asset is to protect their asset, literally, right? So that's what they're going to be concerned about doing, is protecting their interests and their assets within the agency. When we found out that you were a nurse in your background and stuff like that, that was a really big key for all of us, because we were like, okay, she gets it. Like, this girl's going to get it. She's going to get the medical conditions. She's going to get the symptoms. She's going to get the issues. She's going to get it. And I can't.
And I do.
I'm like, you guys, come on, we needed her there. And this is so heartbreaking that you're not going to be there, because I really think that you would have been able to make a big difference, to be honest.
I don't disagree.
Yeah, absolutely. So
I don't disagree on those things. However, it is a little bit, there are different leadership styles, right? I mean, so therefore I just was not really sure, there are some fantastic people that are really working hard and do have that passion there, aside from just, what can we regulate and, what can we shut down, and people that really want to do right by the industry, which I was pleasantly surprised by. There were a lot of people that really want to advance that narrative, and they want to get the education out there, and they listen to what the public is asking for. And so there are some really, really tremendous people that have a lot to offer throughout OMMA. But with any agency, business, corporation, there are going to be some obstacles, and there were just some obstacles that I think, for me personally, I just don't know that I had the stamina to overcome.
Right. And that's a heartbreaking thing there too, just that statement alone, because that just goes to show, and maybe I'll read this wrong, tell me if I'm wrong, but this goes to show the amount of stress and anxiety that position was giving.
Yeah. Right? Yes. Yeah. To me personally, yes. To me personally, absolutely. And again, I don't know that it's necessarily something that is distinct to OMMA, but I think with people wanting government cuts, people wanting to do more with less staff, less people that can make decisions, OMMA was not isolated from that concept.
Right.
So I think you can only pare down so much to where you then just are stagnated and can't get anything done. And so those were some of the things that I wasn't sure I could wait around for, to be honest. And just even for my own personal, I couldn't do the 50-hour weeks anymore. So for somebody, they can, but.
That's crazy because I hear that some of the people in OMA don't even come into the office half the time. And so when you're saying you're putting in 50-hour weeks, and you're throwing down for trying to make change for the patient, but yet we get emails from them at 5:00 on a Friday that turns the industry upside down, and so it's odd, working overtime per se, because you don't hear them talk about it when they hit that little button on Friday at 5 and throw it all up to you.
Right, right. And I can understand that that's frustrating. And I think those were some of the, again, I have not worked in government before. I've come always from healthcare systems, or doing my own company, or doing just, little bits of consulting here and there. So in full transparency, I wasn't sure what to expect other than what one thinks of government, right? Am I going to be able to get anything done here? What's this about? What is this going to be like? And I think there were some things that could have been avoided based on that hitting the button Friday at 5.
Absolutely.
But again, those were some things that I did not see that I had the power to change.
Right.
And so there are some things in that role that really have some great possibilities. There really are, like I said, I had allies and have allies within OMMA and outside of OMMA to be able to say, yes, we want to advance education. How can we collaborate? How can we partner? How can people were hungry for it.
Right.
And so there was a lot of momentum there, but I think that there was a little bit more of I guess I just am a little bit more of a risk taker in that regard. No risk, no reward. Right. So I guess I felt as though there were some things that I was ready to really throw out there. And they weren't wild card things.
Coming to share one of the ideas with us?
Yeah, there were just some, even just on certain things like the rollout of the platform. There should have been, more education that went out, more warnings that went out, this is ready to come.
Yeah.
That was a huge one. But as far as advancing major messages, it's I think there should be just a more visible presence. Mm-hmm. OMMA to be present at more things. That was kind of one of the things I wanted to do coming up and for the spring is that, why don't we have tables in places? Why aren't there more, question answer session? There was a education, kind of a storyboard that we were piecing together and had pieced out together based on, I had written a book for my master's. And so then it was kind of templated off of that to start pushing out education with a whole, wasn't just a matter of monthly. What do we talk about this month? It was an actual series that was actually planned out. We can't do those things without staff. Mm-hmm. So if there aren't the right staff members in place, then that's difficult to do by yourself. Yeah. As you're running a whole nother entity of licensing. So there were a lot of people that were doing double duty, that's for sure.
So do you feel like that if you had the staffing to do it, that they would have taken the ideas and the suggestions to implement change like that?
Some yes, some no.
Yeah.
I know there were some things that I had wanted as far as the research, you know, and actually, and that is moving forward a little bit forward. They have hired an epidemiologist. That was one thing that, you know, we got off the ground before I had left. And so, you know, just even bringing researchers on board, like where are the scientists, where are the clinicians, who's going to be calculating data. I mean, I was hungry for data to know how many 18 to 24-year-olds have licenses, how many females. One of the things that I wanted to see happen was not qualifying conditions, but the conditions. I realize Oklahoma, which is similar to other states, don't have qualifying conditions. However, though, that's data that's helpful, and that was what I wanted to know, is to get a physician portal, which other states have, where physicians actually do all of their recommending directly into the computer system. And so then that way could be an ongoing conversation with providers to incorporate providers, so that patients knew that they were actually getting qualified people to help them. So that way I could find out if, you know, everyone in Enid is having problems with insomnia. Is there a bigger issue there? Like, there should be more public health sharing. You know, if everyone in a 2-block radius that has cards is listing cancer, is there a cancer problem there? Not necessarily just a cannabis problem, you know, a cannabis program there. So I think there's, coming from a public health nursing perspective, there's just so much more that can be generated from that kind of data and that kind of collaboration with the public. It doesn't have to be just a tunnel vision of we're regulating weed and that's it. It's a broader picture.
We had tried to work with Lee Rhodes. This was after our November Patients for Safe Access meeting in 2024.
Okay.
And we had tried to work with him because what we brought up in that meeting was about Superfund sites in the state of Oklahoma, and how geographically, regionally, there are growers that there should be a different type of inspection done just based on the area in which they're growing in, you know, because of contaminated soils and things like that from these Superfund sites. And we had talked with him about, you know, getting like overlay maps done and stuff like that, so that you could actually minimize who did you need to actually affect that way. You know, but it is something that we felt strongly about bringing up to them, because I don't feel like that's something that's considered. You know, in the growing process. Everybody's like, oh, I'm a grower, I got a license. Okay, but did you check the soil?
Correct.
Did you check the water? Did you check these things before you started growing the plants? Because hemp/cannabis sativa, you know, is all a bioaccumulator and draws all of that, you know, impurities up from the soil. And then where does that go? But it goes into the flower, and it goes into the product, and it goes into our lungs.
Agreed.
You know, and that was a big issue. I wish they would have had some form of patient services type situation 2 years ago, you know, because it's been a difficult process making the reportings of issues and how they determine what issues to address. Baffles me. I'm just completely bamboozled with it. We have some companies that we had failed products for pesticides that have now been shut down. They've had recalls, they're in administrative actions, things like that. And then we have companies that have had contaminated products that literally you didn't hear of anything at all being said about it, you know. And so I'm curious how they choose to address those issues, you know.
That part I was, I think, more on a compliance and kind of lab carve out that I wasn't part of. However, I do agree with you. I mean, I think there also needs to be education, and those were some things that we had discussed, is it's not necessarily even just patient education. There have been resources put out for from other states as far as information to growers, information to processors, information to other lab scientists. It doesn't, I look at it more as I guess what my vision or what my hope would be, and that's not even just isolated to Oklahoma, is that there needs to be some sort of a partnership between whoever the regulatory body is and what they're regulating. I mean, there does have to be guidelines and rules. I completely understand that, but I think when you make guidelines for people without consulting people, it doesn't mean you always have to directly go and follow the letter of what they suggest, but I think you need to ask those questions.
Yeah.
I mean, I'm a big one that I don't want a yes man. I would rather have someone, poke holes, give me obstacles, tell me what it is you think I don't know, to be able to advance what I think my agenda is. So is many different things, especially if you're growing. I mean, there's some large grows. I know when I talk to people in Oklahoma, they don't necessarily, some, not all obviously, and not even just within the cannabis industry, is they don't understand that Oklahoma products all over the country. I talk to friends and colleagues, Northeast corner. I was just in Denver a couple weeks ago. I heard from them. California, Minnesota is a direct shot up to 35. I mean, it's shipped all over. So even in light of that, in a legacy concept, I mean, you're talking that if people aren't growing in safe conditions, regardless of like the soil, the pesticides and whatnot, that's not always just a local problem. That spreads pretty tremendously. I mean, there is a lot of cannabis per person grown in the state of Oklahoma, more than probably most could assume per person or consume. So it goes somewhere.
It does go somewhere.
So I would agree that I think, even just safety parameters. I guess I spent the 2.5 years prior to coming to OMMA, embedding myself in the community. So in Minnesota, I didn't just stick with the carve out of nurses. I knew how to do nursing. That I didn't need that. Yeah. I wanted to know who are the growers, who are the processors, how do you extract, what kinds of different ways are you extracting, what are the tips and tricks, who's at that time, Minnesota hadn't gone quite adult use yet. It was just right on the cusp, but who was looking to be in business, so trying to find out all those little niches within the markets to be able to learn all those different areas of like, oh, I have to consider that. Oh, I have to consider that. And I think there's some really knowledgeable people within some of these agencies. However, I think that there are a lot of people that aren't. And without any of that representation within any of these agencies, or at a bare minimum, without any of that liaison or partnership work, you really then aren't going to know even what you're regulating.
So with your nursing background, how many years were you in nursing? Or have you been
25.
25 years.
Yeah.
So in that 25 years, you've been through the prohibition, basically, of cannabis.
100%. Yeah.
You've also been through the parts where cannabis has come through legalization for medical and adult use in different states. And so in Minnesota, is it adult and medical?
Yes.
So it is both. Okay. So you wanted to bring that medical background into what you were doing with patient services.
100%.
And would you say that whenever you were in your nursing career, would you say that any time that you had somebody come in with an issue that was cannabis related, whether it was like cannabis hyperemesis or psychosis or anything like that, did the doctors think to know that, hey, it might not be the marijuana itself, but it might be contaminations within that product? No.
The clinician education out there, it is tiny. Most of the providers that I even worked with, let alone any that I would see or meet or any of those things, they really don't know anything about cannabis. And most of them will be the first to tell you. So some of them, even if they bothered to ask, they wouldn't know what to do other than traditional things.
Right.
Yeah, they wouldn't even know to ask.
Did you know you're alive on Facebook?
No.
Yeah, you are. I didn't realize that. You're alive. I just got
It was supposed to just be recording.
Yeah, so you can end that one if you want to. Keep going on this one. That was a good intro, please.
Right.
Vice versa.
Hey, it's my first time trying to operate stream road without the
That's all
hippie. Hey, hippie, when you see this, don't laugh too loud. Actually, we can take a short break. We can go ahead and end this one and pause on that one, take a break for a second and come back. So,
Perfect.
all right, guys, one love, much love, and we'll be back later.
No, she was just live.
Stay there and that.
I don't know when it picked up though, so
Oh my
it
God.
doesn't look like it was the whole time.